Hello, welcome to another episode of Yummy Data Science. In this episode, we are going to be talking about inpatient data. This data is a data set that I have created from publicly available data set on Medicare website. So as you can see on the header, the inpatient for viz.csv, which we'll be using for exploration and analysis, is derived from synthetic data generated by Medicare fee-for-service inpatient claims. So those of you who don't understand what either synthetic data is or what Medicare FFS inpatient claims are, let me quickly review those concepts. Synthetic data, fake data, is a really useful construct in many branches, especially in healthcare. And the reason is that for the purposes of learning, would you want real healthcare data out there? And you probably say no. So Medicare has created synthetic data. I also have extensive experience creating synthetic data, so I'm going to be creating a video episode specifically on synthetic healthcare data. Now, Medicare FFS. What is Medicare FFS? So Medicare is the payer for 60 million Americans. It pays for their healthcare needs. So it's the insurance provider. Medicare can be administered. It's a government program. It can be administered in one of two ways. And it's a program for older Americans, those over 65, or with some special conditions. And about 60 million out of the 314 million insured Americans are on Medicare. So Medicare comes in two flavors. One is when other third-party insurance companies are engaged in administering it. For example, United Healthcare may administer Medicare through its Medicare Advantage program. The other flavor of Medicare is a fee-for-service when it's direct. So Medicare fee-for-service pays your providers for your care if you're enrolled in Medicare fee-for-service. And by inpatient, I mean these are hospital claims. And what is a claim? A claim is nothing but an invoice. And the reason why it's called a claim and not an invoice is that it goes through the process of adjudication, which is a fancy word for saying that it hasn't been decided yet that that is the final invoice. There is a process of review and there's a process of documentation. And after that, the claims is adjudicated and it is decided whether it is to be paid or denied or to be reviewed in a certain manner. So, okay, back to our data set. So our data set, the one that I have created from a very complex Medicare FFS inpatient file, is simple, but it's not dumbed down. It has real concepts. I'm just choosing to focus on some very key areas, key concepts. So you'll see 1, 2, 3, 4, 5, 6, 7, 8 fields in it. You have BeneID, which is the beneficiary ID or the patient ID. Then you have the claim ID. So think about the claim ID as if you go to Target and you get your receipt and that's your invoice. So there might be an invoice number. So that's what a claim ID is. And then you have LOS, length of stay in days. So as I said, these are inpatient records. So these are inpatient discharges. So person, the first beneficiary ID ending in 91, he had a length of stay at the hospital, he or she or they had a length of stay at the hospital of 11 days. And then the amount that was charged for that stay was $25,000. And there are two codes here, which I'm going to break down shortly in the next slide. But let me quickly go over what is a DRG and description. This seems to be a numeric code, and this is a description of what it is. And in the next slide, I'll be going over what the patient discharge status code is and what is the claim IP admission type source code. So when I downloaded the data from Medicare website, I also downloaded a code book. So effectively reading a data dictionary, this is the patient discharge status. And down here, it tells you um, 01, discharge to home. So that's the most common. You would assume that if you went to the hospital, you were admitted to the hospital, then a few days later you were discharged to home. Number 02, the code is you were discharged to another hospital. And then sadly, there's a code for code 20. So this is a code and it means how did the person come into the hospital? 1, was it an emergency? 2, was it an urgent? 3, was it elective? 4, was it a newborn? And so this can be, as we analyze our data, these can be good columns to differentiate. There you go. This is, so the Chronic Conditions Warehouse Virtual Research Data Center, and this is the code book from there. By the way, the Virtual Research Data Center is a portal, and behind it live Medicare fee-for-service claims. And there are companies that specialize in getting VRDC seats and then going inside the portal, adhering to Medicare's rules, and then taking the data, summarizing it, and then selling the data to companies such as life science companies and pharmaceuticals. And the VRDC has really interesting and useful data sets about the 60 million or so Medicare beneficiaries. And the reason that this is very useful to life science companies and pharmaceuticals is usually pharmaceuticals do not have a direct access on the patient journeys of Medicare beneficiaries. So this is a complete. The next concept I want to talk about is the diagnosis related group. And diagnosis, well, it simply means what is your condition. So if I go into the doctor and I have the flu, well, my diagnosis is the flu. And as a treatment, maybe there was a procedure done at the doctor's office. So that is the concept of treatment. And then perhaps I was given a medication. Well, that's also part of treatment. And then there is, if I am at the hospital, then no two patients are created the same. Some may require more resources. Did you get oxygen? Did you get a blood transfusion? So there's a concept of resources also. So the diagnosis related group was a concept that is created to categorize hospital stays. So, let's bunch the like stays together. It was created in the 1960s at Yale University, and it's a combination of diagnosis, treatment, and resource. But for the purposes of our analysis, let's just think of it as diagnosis. And you will see that some of our diagnoses have the word CC. CC simply means complications or comorbidity. So say you had, your diagnosis was fever, but you also had diabetes, then it would say fever with CC. So, with that comorbidity of diabetes. And then MCC means major complication. So here is our data. And I've just printed out a few rows of the data. And I'm saying here, before you get into any analysis or any visualization, and this is also, Hadley Wickham, whose textbook we're following in this course, R for Data Science, his point. Let's think about it in whenever we are working with data, let's think about it. What's the most important thing to do is to understand it. Okay. And I'm going a little bit further out and I'm saying be curious about the data you see. So for example, I'm looking at it and I'm curious about it. And I see that there are 3 rows with this beneficiary ID ending in 1-8. And there are 3 different claims. And this person has 3 different inpatient stays. One was 12 days, one was 3 days, one was 4 days. So I'm like, okay, 12 days, 28,000, 3 days, 3,300, 4 days, 96. Why is the amount so low? And the amount, the third record for this person is bronchitis and asthma without CC. And it's the same bronchitis and asthma without CC. And that stay, the very first one in our data set, had an amount of 28,000. So why is the amount so low? Well, the first question, whether you did your data transformation correctly. So I'm wondering if I if I did, when I created the summary data set, did I do this correctly? So I'm curious. I want to see what these records are in my source data. I would also want to look at the dates of admission and discharge. And what I'd like to know is, well, did these inpatient stays come back to back, or were they separated by years? Remember that this data is 15 years longitudinal data. And the fourth question I would like to ask is, what is, and this obviously you cannot figure it out from this data set, is what is the patient journey for this patient? What is the holistic picture of their healthcare? So what I'd like to do is look at this patient, but look at all his encounters, including inpatient, outpatient, clinic encounters, his lab encounters. If he had medical equipment, I'd like to see that. If he went to a skilled nursing facility, I'd like to see that. The medications, I'd like to see that. And I'd like to create a patient journey. What happened at every stage. And once you create patient journeys, you have a better understanding of not only patients, but also cohorts of patients. And I'm going to end this with shameless self-promotion. I have been working with healthcare claims data for almost 30 years, and I have a 5-day class on healthcare claims data and related healthcare analytics. So I hope you learned something from my segment today.